And we are live.
Hello.
Hello, tribers. How are you doing? If you can see us, please let me know in the comments. If you can hear me well, please let me know in the comments. Where are you joining us from? Don't forget to click the like button. Let's wait for a few more seconds before people can join us. Yes, we have some people joining us now. Okay, so without any further ado, let's start with today's session. The topic for this session is importance of nutrition in child's physical and emotional health. And for this session, we have with us Dr. Nitin M. Dr. Nitin is a neonatologist who completed his MBBS from Kasturba Medical College, Mangalore in the year 2012 and his MD in pediatrics from Mysore Medical College in 2016. He has a special interest in NICU care, newborn ventilation, CPAP, growth, and nutrition. He is caring and has an utmost patience in handling his patients and kids. Welcome to the session, Doctor.
Hello. Good afternoon.
Doctor, any opening thoughts for today's session?
Opening thoughts. Children are the building blocks of the society. How they eat, how they interact. In the future, it will have a good impact. Very important impact. So the base should be strong. Okay, that's what I meant by nutrition and the social thing. With that, we
Right,
can get better future, better youth, and so many things. Better
correct.
outcome. Okay.
Doctor, could you please share how does a child's nutrition during early development
Mhm.
impact their physical growth and overall health?
Okay, early development. Okay,
Yes.
so early development means, see, first 1,000 days, what we tell. First 1,000 days means initial pregnancy around 360 or odd days. Then the first year of life, then the second year of life.
Hmm.
Total of around 1,000 days. These days are very important for the child. Why? Because the brain grows very faster during the first 2 years and the 40 weeks of the pregnancy. Okay, so what the child eats, what the mother eats during pregnancy, how the mother, how is her activity, what all nutritious food she takes, and how the baby eats in the first few years. So coming to this, the breastfeeding is especially important. We know that breastfeeding babies are of course at lower risk for infection, and one more thing is breastfeeding babies, they have a better outcome in case of the emotional and social and even the intelligence IQ, and a lot of diseases are prevented. So breastfeeding is of most important. Then comes the phase of complementary feeding. So what feeding you give to the baby and how the baby eats, the number of feeds, all these matters, all these are important for the nutritious growth of the and development of the baby. The
Right.
brain growth occurs maximum in the first 2 years. Almost we say 80-90% of growth occurs, although the brain continues to grow till 20 years or so. But first 2 years is very important for the brain growth, and of course the physical body.
Right. Okay. And what role does proper nutrition play in supporting child's cognitive development and emotional well-being?
So cognitive development and emotional well-being, so both go hand in hand. One is the nutrition and how the baby is brought up with the family and the thing. So coming to the nutrition per se, as I told, of course, breastfeeding is important, and that add-ons to the immunity and add-ons to the nutrition intake. And coming to other nutrition, see, the child should be taking a balanced diet, meaning he should be avoiding this junk food. Why junk food is this drinks or this this kind of packeted items, they're more tasty. Okay, the tasty means they of course tend to eat less of the home food, and of course home food may not be matching the other food in taste, especially the packeted. So those things has to be avoided. And in the food nutrition what the baby takes, it should be a balanced, as I told, the proteins, the carbohydrates, the vitamins. It should be in a good quantity. And some organization, they come with kind of my plate idea, where they are shown what kind of food is good, what kind of food. And you might have seen growth, like step by step, the pyramid. So the base of the pyramid is the nutritious food, the staple foods like rice, all these to be taken in the good quantity. Then comes the fruits, vegetables, which also should be taken in the diet. Why? Because these food like rice, wheat, which are more in carbohydrates and proteins, may not match the requirement for the vitamins and other, which will be taken care by this fruits and vegetables. So this is important. But one more thing is fruits should be eaten fresh as possible. Why? Because the cooking, the boiling of fruits will destroy the vitamins. And then comes the good amount of milk products. Milk should be taken. Of course, many pediatricians tend to avoid the outside milk in the first year. After first year, better to start with animal milk, cow milk, etc. And that should be taken in a good quantity. Of course, the milk products can be given before 1 year, like curds, cheese. All these should be in a balanced diet. Shouldn't be more of oily, but oily items also should be there. Oil is rich in PUFA or some fatty acids, which is important for the brain growth. Okay, brain is a major, the majority of the glucose is consumed by the brain. Of course, sugars, the carbohydrate intake is important, but brain growth also requires many other nutrients like vitamins. Iodine is important. Some vitamins are important for the brain structure and how the brain, the cells of the brain, how they mature. For that also many of the nutrients are important. So it should be a balanced kind of diet.
Right. Doctor, we see that even when we are transitioning from breast milk towards a proper
Mhm.
external diet,
Mhm.
we
Mhm.
see a lot of years into toddlerhood and still kids refuse to eat vegetables. So that becomes a pain point
Okay.
of many parents, right? So
Mhm.
do we
Mhm.
then supplement them with vitamin and other supplements? And how do you suggest we introduce more vegetables in a child's diet? Because it's a
See,
pain point.
yeah. So the first year, in the first 6 months, we generally give the milk. Okay, mother's milk mainly. And in the next 6 months, we start the what we say the complementary feeding. Why? The milk is not sufficient in the nutrients, and some other food has to be given. Okay, so this is the time when mother can introduce any food item. But I personally, we generally tend to avoid few things like sugar, salt, animal milk, and any food can be given to the child during that time. So initially, it should be in a puree format. Any food, what I meant is whatever the parent eat, that also can be given like in a smash format, rice items or roti in a smashed, all these things. And even the fruits and vegetables should be introduced. So if at all in the last 6 months of the first year baby is not given any food item, that chances are there that baby can refuse that later. Okay, so coming to the vegetables, of course, it has to be given along with, in this area, we generally tend to give ragi. Ragi sari, what they tell, ragi is important. And along with that, something like cereal pulses combination food is important. And of course, the vegetables. Vegetables, if, it's introduced early, the tendency is like they will eat later also. And, vegetables are, of course, not that tasty compared to the other foods. Okay, then lagging of vegetables is fine. But when the child sees lot of colored food, they should be eating. And the eating tendency should start before the 1 year. We shouldn't wait till the child crosses 1 year.
Right. Okay. We have viewers' questions coming in.
Mhm.
Cow milk is good for child's health. Is cow milk good for child's health?
Of course, of course. Why? Because mother's milk, we generally tend to give for 6 months exclusive mother milk, and later up to 2 years we can give. But the child's demand increases, which may not match with the mother's milk. So we generally tend to give other feeding from 6 months, and cow milk we generally give when the child crosses 1 year. Of course, cow milk is good. It is it has all the essential nutrient which is required for the child's growth. and it has to be started in a phased manner from the first year of life.
Okay. The next question is, my girl is under low birth weight category and still
Mhm.
falls in that category only. But her milestones are correct and she is active. She eats family meals with us. What can I do to
Mhm.
ensure that she gains some weight?
What is the age of the child and how much early the baby was born?
Could you please share the age of your child and if she was born early? She's 3 years now.
Okay. What is her weight now? And what was her birth weight?
She was born at 32 weeks.
Hmm.
Please share the birth weight also and the current weight also. Current weight is 12 kg,
Hmm. Hmm. Birth weight?
842 grams.
Okay, so compared to the birth weight, is 12 kgs okay, but still the child is lagging in almost 1 2 kg compared to the other kids. Okay, so this you can give any food item. What you're doing is correct. Whatever meals you are eating, you can give to the baby, and of course the child has to drink milk. Okay, you can also give other milk products. Okay, to the baby. Milk products means, as I told, like butter and cheese, and also this grams are important for the weight gain of the baby, like green gram or any other item. And if a non-vegetarian, egg a day is good. Okay, but 12 kg is not a bad weight for the baby. But if she is, every child will be different, and not every child should follow in the expected chart. And little variation is fine. If she is gaining weight like this from before, it is good. She has to follow in that chart in the graph what the doctor says.
Okay. Doctor, could you please explain the connection between certain nutrients like omega 3, fatty acids, and vitamin D in a child's emotional resilience?
Emotion. See, the research has shown that few nutrients are good for the brain growth, and especially in that this fatty acids comes PUFAs, what we tell as polyunsaturated fatty acids. How it is beneficial is, research has shown that it is important in the immunomodulation, meaning some certain cytokines which are not good for the body. It improves certain cytokines which are good for the baby, meaning it takes a balance in the amount of how the body responds to any infection or anything. And also it is important for the transmission of neurotransmitter substance which is important in the brain, and a brain has to properly secrete, so that PUFAs are important for that. And even the nerve, the sheath, the covering, even for that it's important. So PUFAs have shown that they are better in the prevention of some psychiatric disorders, and also the immunomodulation, and also mood stability. Coming to the vitamin D, we know it comes from sunlight. Kids should have a good amount of sunlight exposure. Even vitamin D is, research and shows that the depression chances, or falling into depression, is very less with vitamin D. And also it has other benefits, like it's important in the brain structure, and even for the immunity it is important, all this thing.
Right. Okay. Doctor, could you please shed some light on use of sunscreen in kids, because that is something which is being talked
Mhm.
about a lot. Where
Okay.
the doctors ask us to take the kids
Mhm.
in sunlight, whereas some people say
Mhm.
that you should apply sunscreen on kids. So does
Yeah,
it matter?
sunscreen, better the broad, sunlight. When we tell the exposure, which is important for the vitamins synthesis, is the afternoon sunlight, but that is very difficult, but because it will be very harsh, and the heat and other chances are more. So kids should be exposed, whenever they are coming from school. After school, better to play outside. That will have a good amount of sunlight exposure, but not always the sunscreen is required. Okay, not
Right.
always. Some sun exposure is important for them.
Okay. The next question is, my girl
Mhm.
is 6 years old and lean. She is
Mhm.
a very active child, and whenever there is
Mhm.
more physical activity in school, she complains about pain in legs. Her doctor told it's growing pain. So, how to
Hmm.
make this pain less, not so troublesome for the child?
Yeah. So growth pain is a common problem every mother or every parent tells. Okay, especially that occurs when the child is in the maximum growth. That means around below 10 years it's quite common, and that is more severe at night. If they play more or play properly, the pain is more. That is commonly seen in kids. Nothing to worry for that. What she can do is she can do a massage. At night or apply some oil. Some tradition they do this oil and salt application. That is also good. But it usually relieves. The only problem is nighttime the kid might wake up and cry because of the pain. But if it is getting relieved with these homemade remedies, it is fine. No need to worry.
Right. How can parents and caregivers promote a balanced diet that supports both physical and emotional well being in the children?
Okay. So as I was telling, this balanced diet is important. What does that balanced diet mean? There should be a balance in the diet, meaning the whatever the food the child takes, there shouldn't be more of some items like always eating some outside food. That is not good. Once in a while, food is fine, and always eating only roti morning after night. That is also not good. The child should be drinking milk also, and one or two fruits the child should be eating, and even the green vegetables the baby should be eating. So it should be a balance of all. Of course, roti rice is important for the physical activity, for the strength, but always eating only the same thing morning after night is not good. It should be balance of the milk products, balance of fruits, vegetables, and even the pulses.
Okay. Can you share some tips for creating a positive mealtime environment that encourages healthy
Uh,
eating within the family?
okay. So here in India, what especially in a not an isolated family where they come at different time, but especially if you go to rural or if then there's a joint family, they tend to eat in the same time. Okay, like morning breakfast, all of us will be sitting and eating, and afternoon and mainly the evening and night they'll be sitting and eating. So what does this will impact the child? Is child will be seeing adults eating, so they tend to imitate what others do. So that will help in the eating of the child, and of course, eating together is important. And one more thing, what they should do is try to avoid the screen time. How it can be avoided is by eating together, interacting. That would have a better impact you know than watching the TV and eating. So this will also promote a healthy eating. Child will know where to sit and eat and what to eat, and they will of course ask what the elders eat.
Right. Doctor, any points that we have missed out on so far, according to you?
I think we have taken note of all what is important for the child's growth and development. We have covered all the balanced diet per se, and also how to eat and the avoidance of screen time.
Right. So just let's take one last viewer's question before we
Mhm.
end.
Mhm.
Did sudden craving for sweets is due to any kind of nutritional deficiency? My son nowadays craves for sweets. Previously, he didn't like
Mhm.
sweets in any form.
Mhm. Okay. A sweet craving is a common thing. Even even adults also will have the sweet craving. But try to avoid the sweets. Not give sweets every time. Once in a while, sweet must be okay. But because with that only the child will eat the other food. But sudden sweet craving, maybe if outside food is given, which is more sweety, then of course the child will ask for the sweet. Once in a while, sweet intake should be fine, but not like daily or more sweet intake. Sudden sweet intake, of course, may not be due to any other issue. Okay, and some kids will like more of sweet. Some kids will like more of salty. Some kids more of spicy. This variation will be there.
Right. Thank you so much, Doctor, for sparing your precious time and being with us here today. and sharing all this valuable information with our tribers. I'm sure all of us have had so many takeaways from this session. So thank you so much.
Thank you. Thanks a lot, and thanks for the opportunity. I hope the parents are cleared of their doubts and what to feed. Of course, they will find new question later, but I feel most of the important issues they have covered.
Right.
Okay.
Thank you, tribers, for tuning in. Stay tuned for more such sessions just on Parent Tribe by SuperBottoms. It's a wrap on today's session. Thank you so much once again.